My name is Dr. Lisa Higgins, and I completed my project at the Australian and New Zealand Intensive Care Research Centre at Monash University, and that's where I'm currently based now. So I've always loved research. I did my undergraduate degree as a physiotherapist, and we did quite a few research subjects, and I really loved the idea of trying to work out how we can best treat patients to get better patient outcomes. So it's been something I've been interested in since the very start. So it's the REMAP-CAP trial, which stands for Randomised Embedded Multifactorial Adaptive Platform Trial for Community-Acquired Pneumonia. And it's a trial for critically ill patients with community-acquired pneumonia, which was designed to be adapted in a pandemic. And so my part of the project was looking at the long-term outcomes of patients with COVID-19. In the trial, our primary outcome looks at a short-term outcome. It looks at organ support-free days and short-term survival. And that's really important in a pandemic because we want to get the answers as quickly as we can. But what's also really important is understanding the impact that those interventions have on long-term outcomes, the outcomes that are important to patients, so their long-term survival, their disability, their quality of life. So when we looked at the longer-term outcomes, so we found that things like the interleukin-6 receptor antagonist, which we found were beneficial for our short-term clinical outcome, was also associated with improved survival 6 months after COVID. But importantly, we also showed that on all probabilities, it improved quality of life and reduced disability. And this was a really important outcome for us because what we don't want to do when we save people's lives is have them with really high levels of disability or really poor quality of life. So it was really good to be able to show that our short-term clinical outcomes were actually associated with improved long-term outcomes. COVID-19 threw us all, we didn't know what we were doing. We didn't know how to treat it. It was a new disease. And to be able to bring everyone together globally to address such an important need and work out how to treat these patients and how to get improved long-term outcomes for them was just so important in the pandemic. And I think really important to recognise that, it was a huge team effort to bring together so many people and to be able to understand how we can get better outcomes for COVID patients. We all know how devastating it was as a pandemic, and just to be able to be a part of that and show how we can improve long-term outcomes, I think was a real privilege.